Okay, so you notice we've had a change from our agenda. Originally, Warren Newton was not able to be here because of a family emergency. So we've had the opportunity to impanel three people. So three is probably more interesting than just one, very different perspectives. Um, and we've asked Lucy, we're going to start with Lucy, your reflections from everything you've heard from a financial perspective. Well, then we'll move to Simon, who's going to reflect on the non-monetary values that may or may not have come up and the difficulties therein. And finally, we've asked Jody Frost to just wrap us up and give us overall reflections on the workshop. And then we'll have an opportunity to collectively think together about some of these reflections. So would you start us, Lucy? Thank you.
Thank you. And thank you all for inviting me to be at this meeting. I found it really stimulating intellectually, and I think I've learned a lot as well. And in full disclosure, I don't just represent a financial perspective, I also represent a research perspective. And I would start with talking about sort of the drivers of why we're even talking about all of this. And whether you're in research or education or in operations in providing clinical care, there's this velocity of data that's sort of like coming at us like this big tsunami, if you will. There are really sort of changing practice norms that exist. We're really shifting, even the settings in which we're providing care, and do we even do it in a delivery system setting? And then there also is this challenge that we have this incredibly dynamic environment, and any sort of caregiver can't really keep up to pace individually with the amount of evidence that's coming at them and the rapidity with which it's being sort of promulgated. So those are important drivers that I think, and we've heard people talk this morning about how we're really sort of shifting our focus from a really pharmaceutical-driven funding opportunity to now sort of looking at engagements in workplace settings. And when I think about that, I think about the learning healthcare system. And, we've done a lot of work in thinking about that, but that work and that sort of ecosystem has largely been defined around how do we embed research into the delivery system and learn from the practice. And I think what we've talked about in this meeting and what I've heard is what is the need to embed sort of learning of professional development and work development. And as a manager of people in an organization, you do your performance evaluations and you say, what is going to be your sort of development activity for the next year? And those tend to be all individually anchored. And I think what we need to think about as delivery systems is how we sort of refocus that and start to think about, are there other ways to educate teams of people so that we can meet mission critical elements. And so I think that we should take some credit for expanding the thought of what is a learning healthcare system. It's not just about embedding research in that system. It's how do we develop our workforce to continue to meet the mission of the organization. The second point I'd make, we talked yesterday about the value equation, and so in the literature it's cost plus or it's quality plus outcomes over cost. And I made the comment that IHI has added patient experience to the numerator. And what I've also heard a lot about is we also need to add caregiver experience. We've heard a lot of people talk about the caregiver and the impact of this learning on the caregiver. And I'm getting to the business case. But what I made a list of is to say that, we really have an opportunity, and I think it calls for a stronger evidence base around how do we quantify these things about. We heard people talk about the increase in well-being of a workforce when they feel that they're professionally competent, decreases in turnover, recruitment and retention, positive impacts on those things. And then the one I sort of added was a decrease in individual learning burden. So when I think about the people that I work with on a day-to-day basis at the front line, they are so overwhelmed. When I go into the clinics, when I go into the units, the nurses are telling me, I can't do one more thing. But yet we expect them to maintain their professional development on their quote-unquote free time when, most of us go home to our second job where we have to take care of a family and a home and those sorts of things. I don't think we've quantified those well enough with an evidence base that's believable. I have to go to the CFO of my organization on a regular basis and make a business case to them And I don't think I have the evidence to take those things forward in a structured kind of way. So I'd say there's an opportunity for research, so our university colleagues can pick that up. And then the third point I'd like to make is that thinking about what's the value to the investing stakeholders. And in this case, I'm sort of representing the delivery system perspective. And we heard a lot of this, or at least I sort of picked up on a lot of this sort of struggle on what's the appropriate unit of analysis. And traditionally, we've really looked at what's the impact of the learning experience on the individual, and we've measured that. But then we talked a lot about the teams, and what you really want to know is, was the team learning effective? And because they didn't reach the improvement objective set, it doesn't necessarily mean that there wasn't team learning. There might have been rival activities going on in the organization. But then I also sort of heard people sort of talking about, even at a higher level, were there opportunities for that team-based learning to transcend that initial project improvement and sort of escalate out into other kinds of learnings? And I think that's where the time horizon becomes important, and the causal chain that you talked about. So how can you say, because we did this, it led to that? And I think that that's another opportunity for us to think about what's the appropriate time horizon. And then that leads me to my final point. And the final point is, we spent a lot of time talking about the business case in terms of sort of cost-benefit analysis. And that's a traditional way of doing it. But one of the things that emerged in our discussion yesterday was the question, well, when do you break even? And this gets back to the time horizon issue. So the point is that there are two different analytic approaches that answer two different questions. The first question is, if we're comparing competing opportunities to invest in learning, which one are we going to support based on the business case, the costs and benefits associated with that? And again, I'm thinking about the benefits in terms of this more expansive definition, where it's the outcomes, it's the quality, it's the patient experience, and it's also the caregiver experience. But then the second question is how long will it take for us to recoup the investment that we've made to get to sort of break even, to say, how have we sort of lifted the boats, all of the boats in the organization, so we've improved this higher level of practice that meets the mission of the organization. So I think it's a challenge. I think it's a new day. It's very much a new day in terms of my engagement in these kinds of activities as a educator in a university. I've done a lot of work in running certificate programs out of the university and the delivery system, and then now working in the delivery system and development. And I think we need to help those organizations think about the development monies that they've set aside, using them differently. Thank you.
Thanks very much, Lucy. That was terrific. So I want to thank Patricia for volunteering me to do this morning. And apparently, so reflecting on this morning and yesterday, apparently assigning a value in economic terms to non-monetized values is hard in CPD. So that's what I've learnt in the last day or so. And what I was particularly struck by was sitting in on Sylvia's group with Mike and Elena around professional associations. And I think it was Elena, and I don't want to throw her under a bus here, but she mentioned, as we were putting the benefits up for the professional association, how thin that was as a bargaining chip or as a negotiation platform. I thought, ooh, wow, okay. So I hope we don't lose this, because then my whole job and career disappears. As a sociologist, it's all I look at, is the non-monetized values in healthcare and healthcare education. So this idea that they're thin bargaining chips in building a business case, and yet for us in medical sociology, sociology of health professions educations, they're essential to the maintenance and growth of clinical autonomy. So for those of you in different professions here today are in and on a different trajectory to each other in terms of your clinical autonomy, your clinical territory, your ability to interact with your patients in a way that you've been trained to do. And then you hit the workforce and you get limitations based on your clinical autonomy and clinical territory. These are important issues. So it seemed to me that we're looking at value systems here, whether it be hard currency or otherwise, and trying to find a way to balance them out. So I started to think, how do we approach it practically, which is an odd way for a sociologist to think, I can tell you that. So, you know, one of the things I think is really important is the holistic strategy around the development and maintenance of non-monetized values versus tactical deployment of them in negotiations during your business case, which probably goes back to my talk yesterday a little bit. So we need to maintain that we need to make sure that we're espousing all of the core professional values within a holistic business case, but tactically use them according to the stakeholders that you're negotiating with and according to the purpose of the negotiation and the building of the business case itself. So that sounds pretty obvious, but why is this really important? So it's about retaining the professional identity. So for people in my business, in the sociology of education rather than educational psychology or other intervention sciences, we are about viewing education, CPD, as a transmission of values and norms across whole generations and cohorts of people within it. We construct healthcare providers, but we also are involved in engineering good citizens and decent people, fundamentally. That's what education does on a generational and cohort level across society. So it's not simply about embedding or engendering or providing the conditions for people to pick up skills or knowledge. It's about creating people. And so this is a big issue. So what happens if we lose sight of continuing professional development as an educational activity like that? Well, if we lose sight of it, I think it also circles back to the fundamental issue about this thin bargaining chip approach to non-monetized values in a business case, is that we lose the ability to show value in terms of outcomes. The current value system that is the most meaningful for funders in the healthcare system and for patients, of course. So let me give you a concrete example. So we had some great presentations yesterday, some fantastic interventions that crossed over patient safety, quality improvement, the implementation sciences, and showed great impact changes in outcomes for patients, healthcare providers, and so on. But this great integration with continuing education, what I felt was lost a little bit in this presentation was the identifiable part of those bundled interventions in terms of where was the educational bit? Where was the demonstration of the science of it, the deployment of it, and the effect of it? So we find this in lots of different public health, population health bundled interventions. We put in multiple aspects of an intervention, and then we try and tease out, well, which one had the most effect. So if we're burying continuing education in the integration with the other intervention sciences, which I think it has to be integrated, and that's part of my research agenda, which I've been doing for the last 4 or 5 years. How best do we, in education, integrate our methods, our concepts into the intervention sciences? How do we best do it and still show ourselves as being unique and contributing in an effective way, that we are actually impacting change as part of bundled interventions? And so this is part of the CPD identity issue, I think. So that, to me, is maintaining our focus on education and those value systems that those values that we have that are not economic. Actually, if we keep our eye on them, if we retain our language, if we show our utility in integrating with other intervention sciences, I think we're going to show our economic monetary value in terms of how we can impact change. So that was a little difficult to get to. If it was a little incoherent, I guess because I was talking both from the heart and the brain. I'm very passionate about education as an intervention into society. And I get a little worried when I can't see it as part of other interventions that are going on. So I'll leave it there.
And last but not least, Thank you for being voluntold as well. I appreciate that. So my lens is a little different. I actually came to these before, stepped out for a year, and now have a alternate membership role in NAP and was in a different profession. But I need to give you my biases of background and expertise in instructional design and curriculum and workshop orientation. So my lens is going to be a little different, and I'm going to go through what I thought were some of the personal thoughts about the content, process, and structure, the actual design of the workshop, and then some possibilities for the future. So relative to the content, there were quality presentations, very knowledgeable presenters who presented some breadth and depth across the topic that they said they would be, the business case for high-value continuous professional development. And we were given both quantitative, qualitative, and humanistic patient values to assess. And I think the humanistic is undervalued and one that we really need to talk about more so. And they're highlighted for participants, all of us, to consider a more comprehensive perspective of CPD and perhaps an element we didn't have, especially from the lens of the different stakeholders. And I think when you start to get out of your lens and look at what others are seeing, it may not be what we think they're seeing. The panel on accreditation certification today, I gave the top honors. It was probably the best panel. And the reason I believed it was the best, it was thought-provoking, it was innovative, and it questioned long-standing assumptions about how we measure CE. And what I thought was fascinating, not only did it question it, but it questioned it from different ways that when you get out of the box and think out of assumptions, you get into places that you can't imagine, time referenced. We've been doing time-measured CEs, and we know it has no meaning, but it was easy and a simple way to cast it. So for me, the innovation and the out-of-the-box thinking creates new models and possibilities, the what-if thinking. In terms of processes, in using when you structure a workshop and going from knowledge to application to then exemplars that you actually get to work with and touch and feel. So that did monitor that. We learned some new knowledge. We were given examples and how they were integrated. And then yesterday we had an opportunity with some of those examples to actually touch and feel and work with the content and see how it fit or didn't fit, or the complexity of how easy it was to translate that with all the number of variables and all the stakeholders. And when you started putting that long list together of 15 stakeholders and all, you realize the decisions we make are not as simple as we think around high-value CPD. And certainly opportunities to share different lenses. So global, I was definitely struck by our global colleagues who have some wonderful ideas of which none of us, and I didn't know, and need to know more about how they're coming up with solutions that are not US-centric, that we are very aware of. And I think we get a little self-absorbed in the US and don't look outside, and it really broadens our thinking when you get other people who bring different points of view and give us new ways of looking at things and new innovations. In terms of structure, the opportunity to meet other people, I feel bad for the people on the webinar who can't do that and don't have a way to interact. That's part of the richness, is the networking and the opportunity to come back and actually talk and share. The resources we were provided are great. Personally, I like going green, so I would say, is there a way to move some of this to online and not paper? I think it's an expense that probably doesn't need to be expended in terms of a personal aside. And it's easier for retrieval and highlighting than the paper that I don't know what to do when I take back home, and I have piles. I think also the high fidelity exemplars that we use were very helpful as a springboard in terms of structure to get a hold of and then expand from and really move from. So here's my musings about where could we go in the future around this. So I considered this, and if I were assessing this and grading this, I would say this workshop was good. But how do we go from good to great? That's my perception. It is good, but how do we move from good to great? If I'm obviously quoting out there in terms of how do you move an organization good to great. So although the process enabled learning across a continuum from knowledge to skill development to application, it falls short of the two questions, so what and now what? Whenever you get to the end of a workshop, the two questions are so what and now what? What is the meaning? So I might say, we exchange, what could we do with the so what or now what? Could participants in this room and on our webinar each make a commitment to apply high-value CPD in something they're doing, write up a 1 to 2 page summary, submit it, and it becomes a collection of summaries of so what's and now what's. How did it impact something you're doing, either new, changing, or evolving? It would come back and they would actually have a summary, and that summary would be then available to everybody here about ways to expand it. In modeling what we espouse, Should these workshops be similar or be accountable to high-value CPD standards? And if so, do we have a strong business case for how we do these workshops? Are we modeling what we're talking about? So why aren't CEs awarded for this? You've sat here for 2 days. You've listened to profound lecturers. You've had amazing conversations, applied the principles, and not a CE is given here. And I'm surprised nobody said, why aren't there CEs and my profession needs it? And with that, an organization of which NAP is trying to become an interprofessional CE provider across all of them. Would we meet the business case for high-value CPD? I did some cost quick base analysis, and I said, okay, there's a certain monetary value that members submit and a certain value. There's a certain amount of value for your time that's here. And all of your organizations you go back to should be asking, what are we getting for our money for the time you sit for 2 days? That would be what my organization would have asked me and asked me to demonstrate how are you going to use that to change. That's a high-value CPD that we are accountable for, and I'm not sure how we are demonstrating that. And then our outcomes well-defined in advance for these workshops that we actually can assess quantitatively, qualitatively, and the humanistic elements of what comes out of this. I'm a believer of practice what you preach, how you do that. So finally, how could we reframe this workshop to address the application of the knowledge shared and the impact factors of how we subsequently change what we do as participants? Are there long-held assumptions about this workshop and its design that we need to challenge? Using a high business value that can be translated from what we learned to change assumptions about how we deliver a workshop from good to great if we really believe in this model. Thank you.
Thank our panelists for really stimulating conversations. I'd like to talk about next steps. Thank you, Jody. We didn't set this up, but so there will be proceedings, and those will be entered into the conversation. We've made many connections here, or strengthened connections with each other. And Malcolm, you reflected 50 years ago, these are very different conversations. And I would say we're having very different conversations and higher quality conversations about continuing professional development than we even had 10 or 15 years ago. So I think this is thanks to the forum for doing this. You know, the status quo wins by doing nothing. And so it's those of us in this room, through our individual and collective leadership, that we really need to have a sense of urgency about how we're going to provide leadership to make a difference and to change the picture to high value CPD. So I want to take David's metaphor of 10-9-8 liftoff, which is great, and your comments, Jody, about so what, now what, and really ask each table to address this question we've put into the agenda, which is, what is one actionable item that you plan to take forward from this workshop? For those of you who are on the webinar, we'd love for you to Twitter that in, or however we do those things here. And so we'd like to give you, this is really critical because we don't, as Jody reminded us, we're here to learn, but we're also here to do. And it's going to take the leadership of the people in this room and our communities out there to really move this forward. So we'd like you to take 10 minutes, talk with each other, think about one idea or relationship or project that you would like to do once you get back into your workplace or community to take many of these ideas forward. So we're going to give you 10 minutes to do that, and we're going to come back and revisit some of those.